Good afternoon and welcome to yet another exciting Facebook Live session here in KL Fertility Centre. So sorry for the delay, we hit a bit of a technical difficulty, but yeah, we're back. So we have with us our fertility specialist from KL Fertility Centre, Dr. Agilan the remarkable Dr. Agilan Arjunan. So today we are going to talk about a very important topic, which is miscarriage, myths, misconceptions and the management of a miscarriage. So yeah, before I forget, 3 winners will be chosen today to receive an exclusive consultation with Dr. Agilan himself. So send in your questions if you have any myths that needs further clarifications, or if there's anything that you want us to further explain, yes, send in to the comment box below or send it in our personal private messages. So Dr. Agilan would be more than happy to address them right here and right now. Yes. So doctor, a miscarriage is something that is very devastating, something that causes so much grief for the mother, so much sadness, so much anger, and there are so many misconceptions and myths that surround miscarriages. So, and it's still a taboo, and no one really talks about miscarriages. So, what is a miscarriage, doctor?
Well, actually, you have correctly pointed out that miscarriage is something that actually women don't want to talk about it. First of all, if they have gone through a difficult journey to get pregnant, if they lose the pregnancy, and that's is actually terrible. Okay. Now, miscarriage basically means they're losing a pregnancy, right?
Okay.
So, if you look at that definition, miscarriage can be very, very early. That means a woman actually had an embryo, maybe naturally or through treatments.
Okay.
The embryo implanted. They see a positive test, but they don't see a baby by scan. So that's very, very early miscarriage. That's why some people say, I had a positive test, about a week later I had my period. So what happened? Am I pregnant? What happened to me? Actually, they are pregnant. It's a very early miscarriage.
Okay.
Now, if you extend that a bit more further, some women may have implantation, embryo was there.
Okay.
They just stopped growing a few days later. They just see their period on time. They didn't even know that they made an embryo implanted. So of course that kind of miscarriages you can't diagnose, right?
Yes, true.
The more common miscarriages are when we see a pregnancy by scan, 7 weeks, 8 weeks, 9 weeks, then the heartbeat just stopped. That's a more common miscarriage.
Okay.
So miscarriage basically means you had a baby, implanted, they just lose it.
Okay, so that's very sad, doctor.
Yeah,
That's very
it's sad. Yeah.
So I think one of the greatest myths that surrounds miscarriage is that it is always the mother's fault. It is because the mother did something wrong in the pregnancy that she lost the child. So what do you think about this, doctor?
Well, this is a common myth, yeah. Just because the lady carrying the pregnancy, it doesn't mean it's her fault. Yeah. Pregnancy or the baby is 50% male, 50% wife, 50% husband, right? So you can't just blame the female. Yeah. So if to answer that question, that's wrong. It's not anything that the woman did. Where it's very unlikely the woman can do something that is going to cause miscarriage, unless it's intentional.
Yeah. Okay.
Yeah, unless they took some medicine, tried to induce miscarriage. If not, no. The answer to that is no.
So what are the risk factors actually, doctor, that cause a woman to have a miscarriage?
Okay. So when you look at the risk factors, let's divide it into two now. A baby, let's just imagine a baby.
Okay.
50% of the baby is genetic contributed by the mom.
Okay.
50% is by the husband, right? Miscarriage, most of the time, is related to the genetic integrity of the baby.
Okay.
Now, if the baby is genetically normal, the pregnancy is going to flow smoothly and everything is fine. If the baby's genetic is abnormal, it just which gene and at what point the gene is not being activated, that's when the miscarriage happens. Okay. For example, if we have about 25,000, 30,000 genes in all of us, right? Most of the genes have to be working when we are here.
Yes.
Now, when the embryo grows or the baby is growing, all the genes are switched on one by one, just like a bulb switch, right? It's just getting on one by one. At one particular point when it stopped, that's when the miscarriage happened. So that's why you can see the miscarriage at 6 weeks, 7 weeks, 8 weeks, 9 weeks, depending on which gene is not being activated. Right? So the most important risk factor will be genetic. Yeah. Meaning, I'm not saying that when I say genetic, be careful. I'm not saying that it's a genetic of the parents. No, parents will be perfectly normal. When the babies are formed, That's why all of us are different, right? Even siblings are different.
Yes,
You know, why
yes.
everybody is
Unique,
not a carbon copy
yes, yes.
is unique. That's because when the babies are formed, there is reshuffling of the genetic.
Okay.
Now, most of the time, when something goes wrong in the reshuffling of genetic, that's when the genetic goes wrong.
I
Yeah,
see.
that means either the mom or the dad, they have no control over it. Okay, that's what I'm trying to say.
Okay.
That's the first thing.
Okay.
Of course, the other things which somehow we can control it. For example, medical condition of the woman.
Okay.
If she got uncontrolled diabetes, uncontrolled high blood pressure, uncontrolled thyroid problems, all this can lead to miscarriage.
Okay.
This is something they can control. Now, the other things are problems with the uterus itself, which are very, very rare actually.
Okay.
It's not a very common thing. Yeah? For example, they can carry, or the woman can have something in the uterus called a polyp. Polyp is just like a pimple on our face. Yeah.
Okay.
So it's something that grows from the lining of the uterus itself, the lining of the womb, where it can actually probably increase the risk of miscarriage. How do we know that? We know through IVF studies.
I see.
Now, if you ask me how many of those women are walking out there with a polyp, they got a successful pregnancy, we don't know.
Okay.
Okay? So these are a few things. And of course, the other things are like abnormal uterus. Very rare things, they're just born with double uterus, or the uterus doesn't develop properly. All these are very, very rare stuff. Now, if you look at the man, when you look at the man, for example, okay, let's say, as I said, men contribute 50%, right, to the quality of the embryo.
Okay.
So it also goes back to the quality of the sperm.
Okay.
Now, if the man has something that reduces his quality of the sperm, of course, he's going to contribute to reduction in the quality of the embryo, which leads to miscarriage.
Okay.
Same things, smoking, alcohol, which are also often we know that actually reduces the sperm quality.
And of course, the age of the parents.
Yes, age is important thing because it again goes to the quality of the egg of the woman.
Okay.
Yeah.
Okay.
Yeah. Increase age meaning reduce quality of the egg,
Okay.
reduce quality of the embryo. That's a simple maths there.
Okay. Okay. So what about, doctor, the myth that exercise can cause a miscarriage? Like really strenuous maybe exercise.
Yeah. Unless you say a woman is running a full marathon in the first few weeks of pregnancy, maybe, because it's too strenuous.
Okay.
Any other things they do exercise. In fact, exercise is recommended during pregnancy.
Okay.
Yeah, of course, not too much. Not too much. Everything is not too much. Like if you look at professional athletes, right? The common question is, should I stop things? No, they're not. They actually continue the exercise, probably to change exercise regime. Meaning they're still doing exercise. They're still going for trainings, even in early pregnancy. Nothing happens. So it goes back to the embryo. Again, goes back to the baby. If the embryo is normal, you're going to get that pregnancy no matter you do an exercise.
Okay,
Yeah?
good. That's good. That's good to know. Doctor.
Yeah.
So, what about, like, say, a woman doesn't want to have sexual intercourse with the husband during early days of pregnancy? What about that?
Yeah, that's also another interesting myth, right? Because you just don't want to disturb the pregnancy. You just worry if you jump too much, if you walk too much, if you shake too much, or during sexual intercourse, whether it can actually lead to miscarriage. No, it's not. Sexual intercourse not been shown to reduce increase miscarriage rate. Of course, it's always a small worry if you excite the cervix. Can you cause preterm labor? Yeah, that's something that people talk about it. Also, the evidence are not supporting that.
Okay. And what about air travels, doctor? So, is it recommended or we should not go for on a flight during miscarriage to prevent miscarriage? Yeah.
Okay. See, when a woman gets pregnant, they don't have a disease. You must understand that. That's what I tell my patients. You are pregnant, so you don't treat yourself as though you have a disease.
It's a wonderful thing.
Right.
You should embrace it.
Correct. You just have to go through the pregnancy. It's something that's supposed to happen naturally in most of the women. Now, air travel has not been shown to increase miscarriage rate. That's for sure. People can. Some women are very busy. Their job involves a lot of traveling, including air travel. Nothing happens to the pregnancy. You can rest on the bed for the first 3 months. Tie yourself up to the bed. If you're going to have a miscarriage because of genetic issues of the baby, you're going to have the miscarriage regardless what you do.
Okay, so
air travel, you can go.
So more baby moons. I see many people going for baby moons once they get pregnant. So all the more reasons to go holidays.
Go ahead. Take a good holiday. You deserve that. Yeah.
Yes. So another one of the myths is if a woman has spotting or bleeding during pregnancy, this inevitably leads to a miscarriage.
No, it's not true. Well, miscarriages, of course, one of the earliest signs of miscarriage is bleeding.
Okay.
Okay, so when a woman see a bleed, they think, no, definitely I'm going to get a
So
miscarriage.
you're always
No,
scared,
it's scared. It basically just goes back to your psychology. It goes back to their journey to reach there in the first place, right? If you had a tough journey, you need to treatments, especially IVF, you will be worried. And I don't blame.
Especially those who have gone through assisted reproductive.
Correct. Gone through an IVF, I don't blame the woman. Yeah, I don't blame them. So bleeding not necessarily leads to miscarriage. Women can have a lot of undiagnosed bleeding in early trimester, meaning the first 12 weeks. They can have bleeding. Sometimes it's quite common. It's not mean that it's a miscarriage. Now I've seen patients who had bleeding throughout their pregnancy. I've admitted patients before up to about 32 weeks.
Oh, wow.
She was in the hospital because we don't know what to do, right?
Okay.
Admit, rest, some medications.
Okay.
She was fine, spots here and there, we monitor baby growth. She was there after 32.
Okay.
She said, doctor, is enough, I want to go back home for a while. She went back home, unfortunately came back at 35 weeks and delivered.
Okay.
Yeah, but at least she reached 35 weeks.
At least happy ending
Correct.
for them.
So it just tells us that we know so much. So bleeding, yes, is one of the signs. Usually we give medication, trying to stop the bleeding, try to support the pregnancy. That's important. We don't take it as, it's normal. We do what we can. Of course, the rest of it is just give time and
Okay. What are the other symptoms maybe that a woman might have that, this might lead to a miscarriage?
Okay, besides bleeding, sometimes pain.
Pain,
Okay, because you know that the uterus trying to expel the pregnancy, they have cramping pain. That's already too late.
Okay.
Yeah, most of the time there is no symptom.
Okay.
Okay, no bleeding, nothing. Just do a scan. They see a heartbeat at 1 week, 2 or 3 weeks later they don't see a heartbeat. These are the most common symptoms. Unless it's very very early miscarriage, they can have bleeding.
I see.
Yeah.
Okay. So another thing would be how long should a couple wait after having a miscarriage? So most of the myths are saying that you should wait for 6 months, 7 months to try to conceive again. So what are your thoughts?
Well, I'll say it's too long. You get pregnant again. Let's say if a woman gets pregnant naturally, she had a miscarriage.
Okay.
You get pregnant again when you are ready.
Okay.
Okay, but we'll say at least about 1.5 or so, because if somebody delivered a baby, okay, we say pantang period lah, it's a month, right? Or medically we say about 6 weeks, where the body system should revert back to her pre-pregnancy state.
Okay, sure.
So depending at the stage of the miscarriage, okay, I will say at least about a month or plus.
Okay.
Why you need a month also? Not also because psychology.
Yes.
You need to be ready to move on.
Yes,
you need to ready to move on, and also it brings back a system back to pre-pregnancy state. If she starts to ovulate, then she's ready. She can just get pregnant.
Good,
6 months is a bit too long.
Okay.
In fact, her chance to get pregnant will keep reducing, right, as the age advances.
Oh yes, that's true. That's very true. So another myth would be if a woman has miscarried once, she most likely will miscarry again.
Okay. So this is not true.
Okay.
See, if the woman got to miscarry more than twice, more than 3 times, it means she had a recurrent miscarriage, right? This is a very small proportion of the woman has that.
Okay.
Let's say in a young woman, okay, she's 25, 28 years old, right? Roughly about 1 in 5 or 1 in 6 of them will miscarry.
Okay.
Even in a young person. So it's just by chance. Am I talking to you about genetic composition of the baby? It's just by chance.
By chance.
It doesn't mean they're going to have a miscarriage again, and don't have to be afraid of trying to have a baby.
Okay.
No, most of the time they go on and they'll have a successful pregnancy.
That's very good to hear. So what can be done, doctors, to prevent a miscarriage from happening? Since most of the women will be a bit afraid to try to conceive again. So anything that they can do to prevent it?
Okay. Now, for those who had, let's say, more than 1 miscarriage, right, so always I understand that they'll be very worried. They'll be thinking, now I don't want to go through that again. Can I do something to try to prevent that, right?
Yes.
So when you say try to do something, first of all is we need to have an interview with the couple.
Okay.
To try to find, do they actually have a reason why they miscarry?
Okay.
That's very important. That's why consultation is important.
Okay.
We'll assess both men and female. Try to find out, is there a modifiable factor that we can change so that it don't happen again.
Okay.
So this first of all involves an interview. Now through that we'll think, okay, is there any other assessment we can do for them?
Okay.
So what are the assessment you're talking about? Okay, go through an ultrasound scan, check the uterus, see whether is there any issue with the uterus lining, is there any issue with the uterus? Okay. Sometimes we also check husband's sperm, just make sure that sperms are fine.
Just to be on the safe side.
On the same time so that we don't miss anything.
Yeah, true.
The other thing is some women, if we suspect by ultrasound scan that they have some issues with the uterus lining, they may need an additional procedure called a hysteroscopy.
Okay. Fancy term, yeah.
Okay. It's a very simple. Hysteroscopy basically means we put a telescope into the uterus to have a look at the uterus lining directly.
Okay.
Okay, use a TV monitor, we can have a look.
Okay.
So that's called a hysteroscopy. It's a very simple procedure, probably about 15-minute procedure. Nothing to worry about. Sometimes you can just do it as a daycare. Come in the morning, do it. Unfortunately, you need some sedation. Sometimes you can do without sedation. Okay. Now, hysteroscopy will tell us whether there's actually a problem to confirm what we find by scan. Now, if there is a problem, for example, polyp, I mentioned about polyp earlier, we can easily remove the polyp and then they can go on. The next month, try to have a baby. Okay. Now, once we do that, sometimes the other assessments are, sometimes we do some blood tests. Okay. Especially for those who have a recurrent miscarriage, 2 times, 3 times they have a miscarriage, especially if they've done in an IVF, embryo looks normal, what's going on, right? It's a normal embryo, they should get pregnant, or it shouldn't have a miscarriage. So this miscarriage, this blood tests are very special blood tests, okay, where we try to find, is there anything they carry, anything that causes their blood to get thicker, thicken up, or so I don't use a fancy medical terms, So if you find those reasons, you don't have to worry. If they get pregnant again, we can start them on certain medications, to overcome that problem.
That's good.
Now, for some time, you do all the tests come back normal. Now then you're thinking and say, what else is going on? Now, when the tests are normal, that means we back to our initial assumption or initial reason, which is the genetic of the embryo, right? So those couples, sometimes they need an IVF. They make an embryo. They do a genetic test on the embryo called pre-implantation genetic screening, or PGS, short. When they do that, then we realize, that PGS itself gives them an answer. Okay, some of them have, let's say, 5 or 6 embryos. Then they realize 4 of the embryos are abnormal. Then we know that that's the real issue with the genetic, right? When you transfer the genetically normal embryo, then the pregnancy will be good. Miscarriage rate reduced significantly. Okay, so some of them need that IVF and PGS. Okay. Now, what about other things? Now, let's say somebody has to go through an IVF. They've done a PGS. The worry is still there, right? Even though you put back genetically normal embryo, the genetic test doesn't tell you 100% everything is normal, right? So we do give some other additional treatment to the woman. Sometimes in the form of tablet, or sometimes rarely in the form of injections, to try to support the pregnancy so that reduce the miscarriage rate.
So I think we have a few questions, and thank you for your questions. Keep them coming in. So how long, doctor, after a miscarriage should one start going to work?
Okay, they trick the question a bit, Well, it depends what you went through in the miscarriage, whether you needed a surgical procedure to evacuate the pregnancy. Let's say miscarriage at 8 weeks. It's not a spontaneous miscarriage. Pregnancy is still there. You may need a procedure called a DNC. If you need that, usually we give an MC about 1-2 weeks. Once you're fine, you can go back to work.
So it still comes back to the initial explanation. If the woman is ready, you can go back to work.
Usually not too long. If I say too long of an MC, of course the boss going to come after us, right? Why this doctor is giving 2 months MC? Yeah, it's not that long. Usually after about 2 weeks they can go back. If let's say it's a spontaneous miscarriage, well, even though it's a spontaneous, no surgical procedure, well, I guess about 1 to 2 weeks they need time to rest. To be fair to them, then they'll back to work.
So, doctor, when can one expect her menstruation after a miscarriage?
Okay, that also depends on how fast the ovary resume the activity. So once you get pregnant, everything is shut down, right? There'll be no egg developing because now focusing on pregnancy. Now, once they had a miscarriage, some of them will have a period next month itself. Or sometimes, let's say 4 to 6 weeks, they should able to see a period. Some of them take a little bit more longer because your body system takes a bit of time to grow the egg first. They ovulate the egg, then 2 weeks later they see their period.
I see. Okay, if a patient was on birth control pills previously, so does it increase the chance of having a miscarriage?
No. Sometimes people are on birth control pill for whatever reason. God say you're going to have a baby, okay, and they get pregnant. So what happens? Just stop the birth control pill. Nothing happened to the baby. So it's not because of the birth control pill.
I see. Okay, so what about why does a woman with PCOS, I think polycystic ovarian syndrome, have a higher chance of having a miscarriage?
Okay, that's back to the in a PCOS patient. sometimes many of the eggs are abnormal.
Okay.
We know that because of an IVF.
Okay.
Sometimes we get more eggs than expected,
Okay.
but we realize we won't be too happy yet. We say hold on
Okay.
until we look at the eggs. Then we realize many of those eggs are immature, they're abnormal. So then, if let's say we extend that to someone who got pregnant naturally with a PCOS,
Okay.
higher likelihood that the egg is abnormal, give rise to an abnormal embryo. That's why they have miscarriage.
I see.
But it doesn't mean that they're going to keep having miscarriages. It's not.
Not true.
Yeah,
Okay.
it's not true.
Okay, so another patient has diabetes mellitus. So how should she control the risk to prevent a miscarriage?
First of all, control the diabetes.
Okay.
Well controlled diabetes. If let's say the woman have a diabetes, it doesn't mean she's going to have a miscarriage.
Okay.
So if you control your diabetes well, your risk of miscarriage is no different to age-matched woman, another woman without miscarriage.
Okay.
So your risk will be the same.
Same. Okay.
So it goes to any other underlying medical problem.
Okay.
Control it well so that you reduce your risk of miscarriage.
Is the woman more fertile immediately after a miscarriage?
Well, I suppose the fertility is the same.
Is the same.
It's the same. If she is fertile, once the ovarian function resume,
Okay.
the chances are the same.
The same. Okay.
Yeah, unless she says she's trying 1 year down the line, probably her chances are a bit more lower.
Okay, I
Yeah.
see. Doctor, what advice can you offer to a woman who has suffered a miscarriage and is now scared to try to conceive again?
Do not stop. Do not stop. That's the first thing. Yeah, maybe we should share a video. I had a video in the morning.
Okay.
My wife sent me the video.
Okay.
It's something very touching video and saying
Okay.
that. Well, let's don't talk about
No,
that.
we'll add the link
We
in
add
the
the
comment
link
below
later
then.
then. Okay. Now, first thing is do not stop.
Okay.
Okay. You got a miscarriage. Most likely is by chance.
Okay.
You need to be strong. That's why I said take a bit of a time. Do not decide on your next course too early. Because
Okay.
when you're distressed, right, you're not going to make the right decision.
Okay.
Give a bit of time. You can take 2 weeks, you can take 3 weeks, you can take a month, right?
Okay.
Now, after that, you sit and say, okay, now I really want a baby. I move forward.
Okay.
Never stop. If you stop, you're not going to get anything, right? If you don't stop, you will get the baby.
It goes back to doctor's principle of giving hope to the patient, always
Yeah.
having hope.
Correct, correct. If you have a hope, you will move forward.
Yes.
So if you have a miscarriage, it doesn't mean it's the end of the world. It's not.
Okay.
Yeah.
Good. Try and try again.
Yep.
Okay. So this is a very interesting one. Eating pineapples, does it cause a miscarriage?
Okay. Well, you can eat all the fruits. The fruits are good. Well, it's a myth. Many years ago, I also thought so. Yeah, maybe it can cause that. Actually, there's no medical evidence for that. In fact, not only pineapple, people ask papaya. How about
Papaya. In Tamil
Papaya
movies,
is
it's
another
always
one.
papayas.
I don't know. That's because of the movies. I know. We have to go and speak to the movie directors. Shouldn't be putting this kind of
Yes.
things. There's no medical evidence for
Okay.
that. Yeah. In fact, papaya is good because you get constipated easily in pregnancy.
Oh.
So papaya, in fact, is quite good.
Okay. Yeah, to cure the constipation.
Yes.
Okay,
It
good.
is.
Doctor, is there a chance that a patient can miscarry if the partner's age is older?
Meaning the man's age
Husband,
is
yeah.
older? Well, okay, let me see. Let me put it this way. There is some suggestion that if the male partner is older, you may give rise to certain condition in the baby.
Okay.
There's no direct link to say there is miscarriage.
Okay.
Miscarriage usually linked to the age of the woman,
Okay.
right? We're talking about autism, schizophrenia for the baby. Yeah, there is some evidence saying that older man can give rise to that.
Oh, I see.
Okay, but let me add on. There's another contradicting report saying that
Okay.
when the man is older, apparently the children appear to be smarter.
Oh, okay.
We don't know whether it's linked to autism.
Okay,
See,
I see.
autism is a big spectrum,
Spectrum,
right?
yes.
Now, some autism kids, they don't really, display all the symptoms. In
Okay.
fact, they're actually very, very smart
Oh,
because it's linked to the autism gene.
I see.
So miscarriage, maybe not. But doesn't mean that you marry an older man so you get a smarter kid. I'm not saying that, yeah.
Disclaimer. Okay.
Yeah.
Okay, I think this does walking too much cause miscarriage? I think this goes back to the
Go
exercise.
back to the exercise.
Yeah.
Well, if I say an athlete, professional athlete can still exercise.
Okay.
Now, what do you think about walking?
Yeah,
You can.
true.
In fact, you should exercise. You shouldn't start a sedentary lifestyle just because you got pregnant.
Okay.
Yeah.
So keep them coming, keep the questions coming. So doctor, any support groups or for counselling for a patient who has just had a miscarriage?
Interesting. Of course, there's a lot of support group overseas.
Okay.
Well, in Malaysia, yes, we have. I'm working with one support group.
Okay.
but unfortunately, just started with the Indian group.
Okay.
I'm sure there are many more.
Yes.
Okay, there are many more groups which probably I'm not aware of because I'm not part of them.
Okay.
I'm part of certain fertility support groups, because they ask advice and
Sure.
also. Easy thing is just go to Facebook. Everybody has Facebook.
Okay.
Just type it. I'm sure there is some.
Okay.
Yeah.
Okay, sure. So it is important to have proper support.
Yes.
Support for.
But the main support is not, well, of course you always look for a third person. The main support is husband and wife. Support each other. Yeah. That's what the video is talking
yes,
about.
okay, so
video
the video.
earlier.
Doctor, can you explain more about DNC? Just now you mentioned dilatation and touch.
Alright, DNC is just a term. It means a small surgical procedure. Try to evacuate the pregnancy.
Okay.
Now, nowadays we don't do DNC so much. What we do is that, of course, the woman have to go under anesthesia. A very short procedure.
Okay.
We just insert a small tube.
Okay.
We don't curate things anymore.
Okay.
We just insert a small tube and just suck out the pregnancy so that it's evacuated from the uterus. That's
I
it.
see. Okay.
10-15 minute procedure.
Okay.
Very
And this is done in all the miscarriages or a
No.
certain type of miscarriage?
Most of the miscarriages don't need this.
Okay.
So even a patient has gone through IVF, right?
Okay.
They had a miscarriage, and we're asking, doctor, should I need to do procedure? I say, no, you wait. Give time. The thing is go back to the couple. Some of them, you have a baby, it's not a life. And the woman is carrying it. I need to talk to her.
Yes.
Are you comfortable to wait or not? If she's comfortable to, my advice would be just give another 1 week or 2 weeks. Most of the time, the bleeding will start.
Okay.
She'll have a spontaneous miscarriage. You don't have to do anything else.
Okay.
I've followed women up to about 6 weeks.
Okay.
They are okay. They say, I will wait, doctor. Waited 4, 5, 6 weeks. She had a miscarriage, spontaneous miscarriage.
Okay.
By waiting, the biggest issue is, or biggest concern is, you worry, am I going to have infection by waiting? No,
Yeah.
there is no evidence for that.
Oh, okay.
Yeah.
So is it like, if say the patient has already discharged the fetus, I mean, should they save it and bring it to the clinic or?
No, well, okay. For someone who have recurrent miscarriage, where we need to do that DNC procedure, sometimes we want that pregnancy tissues because we want to do a genetic testing on the tissue, on the baby's parts, to check whether baby actually carrying any genetic problem.
Okay, sure.
So this is if you want to find answers. Now we have first miscarriage, probably not, unless you have repeatedly having a miscarriage.
The recurrent miscarriage.
Because you want to find an answer why.
Yeah, true.
So probably with that, only that's the only indication. If not, you don't have to actually
find closure for the.
Yes, you don't have to actually bring and show us. Well, I mean, it's a baby. Some people precious. I would say probably you keep it. Maybe somebody do some. Some people do some ceremonies. It's a baby, right? It's actually a living baby and die.
True. Okay, doctor, is there a special diet to prevent miscarriage?
I've not come across any special diet.
Okay.
It's not only miscarriage or even fertility. I haven't come across any special diet.
Okay.
I would say just keep to a healthy diet.
Okay.
A balanced healthy diet. Don't eat anything too much.
Okay.
Right? Don't have nasi lemak 3 times a day. Things like that. You don't
so everything in moderation.
Yes, everything in moderation. Make sure you're taking your vitamins, your preference vitamins, because sometimes we don't get enough vitamin from food alone. Of course, depending how you cook it, right?
Yeah.
So make sure enough vitamins. All that will make sure your general health is taken care to reduce the miscarriage.
And try to avoid all the risk factors, the smoking. What about caffeine, doctor?
Interesting.
Coffee.
Right. Too much of a caffeine has been linked to miscarriage. Yes. Too much. When you say too much, how much is too much?
Yeah.
Right? Well, probably about more than 5 cups a day. Yeah.
Okay.
Study suggests more than 5 cups a day.
Okay.
And also depend what's your strength of the coffee. So it's very difficult, very subjective.
Okay.
Now I always tell patients, I say, maybe if you drink coffee is fine. Maybe keep it between 1 to 2 per day is fine.
Okay.
Yeah.
Okay, so no caffeine then. Reduce the coffee.
Well, you can tell. I would say no caffeine. Coffee a day you can't stop it.
True. Yes.
Maybe 1 to 2 per day. That's fine.
So, doctor, another question. This patient did IUI 3 times but had miscarriages. So, any advice on this, doctor?
Right. This it's a very general question. First of all, we need to know more about the patient who asked the question. So why? He said, do you have other risk factors or not? Do you have a diabetes? In fact, do you have a PCOS?
Okay.
And the other thing is to check what's the age of the woman. Yeah.
Okay.
Increased age, increased chance of miscarriage. Now, if she had 3 times, she can get pregnant, and then 3 times miscarriages. I was quite sorry for her. Now they need to start the assessment. Probably you start through the workup, blood test, check the uterus running. Is there anything she carrying in the uterus
Okay.
that leading to, why she's having 3 times in a row?
Okay.
I would advise her, please start some assessment so that you find the reason. Yeah.
I think I'm supposed to say hi to Chandramati Raju.
Oh, really?
Yeah.
I think I know who is that.
Yes.
Okay.
Okay.
Hello, hi. I'm Metran Chandra.
Okay. So I think that's it for today. We have
Okay.
reached the end of our Facebook Live session for today. We hope that all the information that Dr. Agilan has so generously and graciously shared with us today would be of help for us to understand more about miscarriage and shatter all the myths and misconceptions we previously had. So thank you very much, Doctor, for that.
Just to say a word.
Yeah.
Miscarriage, you don't have to be afraid of miscarriage.
Yeah.
It happens to everyone, or anybody can have a miscarriage.
Okay.
Never blame yourself for miscarriage. It's not your fault.
Mm-hmm.
It's not your husband's fault. It's not your mother-in-law's fault. Nobody's fault. Yeah.
Okay.
Right. So the thing is that you need to keep moving forward. If you have a recurrent miscarriage, be brave to step forward. Start some form of assessment to know why. Because you find the reasons. I always say, if you find the reason, then your mind will work towards to finding a solution.
Okay.
So you need to keep moving.
Okay.
Yeah. Okay.
So
Thank you for listening.
Yes. So before we leave, Dr. Agilan has some exciting news. Dr. Agilan will be organizing health education, male infertility education. It will be on men's health and parenthood, and this will be on the 18th of November 2017.
Next week Saturday, afternoon 2 p.m. you are starting it. That's because in conjunction with the Male Health November, it's known as the Male Health Month. So I thought of actually addressing an issue that not many people talk about.
Yeah, it's still
which
a
is
stigma.
health.
Yes.
Correct. When female infertility is already a taboo thing. We talk about male, it's more difficult. So I'm opening up a platform so that couples can come in, okay, wife and husband both come in to understand something about male infertility, what you can do, how you can overcome. I'll share some things. True stories. I'm going to share some true stories, how people have persisted and then they've overcome. They thought they're not going to have a baby, now they have a baby again.
That's great. That's great.
That's next week Saturday.
Yes, that's
hope
on
you all can join us.
Yes, 18th of November, 2 to 4 p.m. here in KL Fertility Center, DC Mall. So it's a free health forum, and there'll be light refreshments towards the end. So it'll be something exciting for all of y'all to join us. And alternatively, y'all can make an appointment to meet Dr. Agilan himself here in KL Fertility Center. And Dr. Agilan has his very own blog site, dragilan.com, and this blog site is tales and inspirations through the eyes of a fertility specialist. So it's a very unique way of when you're reading the articles. It's excellent. So stay tuned for that. And that's it. Thank you very much, Doctor, for your time, energy, effort, your knowledge. It was a pleasure to sit in with you today and to talk to you.
Thank you. I hope they have benefited.
Yes, we really hope. And thank you for joining us, dear viewers. Thank you for the support, and we look forward to having you join us in the next